I'm John Strum, and this is Real Talk MS. It's April 28th, and we have a lot to talk about. Earlier today, I heard someone say the only thing that's spreading faster than COVID-19 is misinformation about COVID-19. And I guess that statement struck a nerve with me because earlier this week, someone who will keep anonymous listened to last week's episode of Real Talk MS and posted this on social media. And by the way, as I read this social media post, I'm going to replace their four-letter words with the word freak. So every time you hear freak, please feel free to substitute back in your favorite four-letter word. So here we go. This is freaked. Everyone with MS has a freaked immune system. That's why it attacks our brains. For goodness sake, we are vulnerable because our immune systems want to attack us. Get real. This is life or death for us. So angry. So I've already reached out to the person who posted this, and I want to say a few things about it. First, I don't mind getting a negative review. Everyone's entitled to their opinion, and we don't live in a one-size-fits-all world, so I can appreciate that this podcast isn't going to be for everybody. But what disturbed me about this social media post is that the person writing it has their facts wrong. And that bothers me because making our way through these uncertain and difficult times is challenging enough without having to navigate life using bad information. If you're a regular Real Talk MS listener, then over the past few weeks, you've heard one leading neurologist after another explain that having MS does not compromise your immune system. It changes your immune system, but that's not the same thing. You'll hear another MS expert say that again today. And the reason this has to be repeated is that a lot of people still haven't heard it, or they've heard it but they don't believe it, or they've just stopped processing information. I've always believed that knowledge is power, and in this case, knowing the truth, understanding the science, has the power of mitigating some of the fear and anxiety that some people are living with right now. So no, we aren't vulnerable because our immune systems want to attack us. And in reaching out to the person who posted this comment, I offered to have a private conversation with them, and I'd be happy to connect them to some very well-credentialed experts who could hopefully help them dial down their panic. But so far, I haven't gotten any response to my offer. And as to their reminder that this is life or death, as someone who lost their wife to progressive MS just 8 weeks ago, I think I have a pretty good grasp of that reality as well. As I seem to remind you almost every week, it's become more important than ever to make sure you have access to credible information that you can count on. And today, you're going to hear from 3 experts on very different aspects of COVID-19 and MS. First, Kathy Costello, the Associate Vice President of Healthcare Access for the National MS Society, is going to give us our weekly update on COVID-19 and MS. Then, Mandy Rohrig, a physical therapist specializing in the rehabilitation of individuals with neurological diseases, with a special emphasis in treating people with MS and Parkinson's disease, is going to talk to us about exercises that you can do at home to stay healthy. And then you'll meet Nancy Guerrera. Nancy is a registered nurse who was diagnosed with MS in 2007, and then last month, Nancy, along with every member of her family, was diagnosed with COVID-19. So you'll have an opportunity to hear exactly what it's been like for someone living with MS to contract COVID-19 after being on Ocrevus for the past 3 years. But before we get to Nancy Guerrera, there's some updated information about MS and COVID-19 that we want to share. So in a moment, you meet my first guest, Kathy Costello. Kathy Costello is the Associate Vice President of Healthcare Access for the National Multiple Sclerosis Society. Kathy leads the Society's strategic initiative on access to quality health care, which focuses on self-advocacy, professional workforce development, healthcare professional relationships, and wellness. Kathy was a nurse practitioner and adjunct assistant professor at the Johns Hopkins MS Center in Baltimore, Maryland, and she's written and lectured extensively on MS and MS care. Welcome to the podcast, Kathy.
Thanks so much, John. It's a pleasure to be here.
In last week's podcast episode, I told everyone that there were no FDA-approved at-home tests for COVID-19. But we're living through a situation that changes day to day and sometimes even more frequently. So the day after I reported that there were no at-home COVID-19 tests, the FDA approved one. What can you tell us about that coronavirus home test kit?
Yeah, thanks. This is really exciting news. So you're right. On Tuesday of this week, that's the 21st of April, the FDA approved a home testing kit. It's not just used for home. It can be used in the laboratory as well, but it was also given approval for home use. And the test is called Pixel, Pixel, and it will be available by prescription. There will be a cost associated with it, and we're certainly hopeful that insurance will cover that cost. And it will be available widely. And I say will be. It's not available widely right now. And the first people this will be used on are the frontline healthcare workers and first responders, because it's really important to know if they have been exposed and if they actually have this viral infection. So once there are sufficient numbers of these kits, then healthcare providers can prescribe them for anyone, you, me, anyone. And you would actually use this kit at home, take the swab, place it into your nose, and then put it into the part of the kit that will be used to send it back to the lab. So you'll take that swab, not touch it with anything else, put it back into the return envelope or box, and send it to LabCorp, where it will take 1 to 2 days for an answer on whether it's positive or negative for COVID.
You know, one thing that my listeners keep reminding me that they're very interested in staying updated on is the latest information about MS disease-modifying therapies and COVID-19. What are we learning?
That's a great question. And boy, do we hear that all the time. And not just from people with MS. I have to say, we also hear this from providers. And the reason is that right now, there are no data that really tell us anything. So in order to know if a disease-modifying therapy is a factor in people getting this virus or having a worse course or outcome if they are infected, you need to have people who are infected. Because remember, this is a novel coronavirus, meaning before December of this year, it was not seen in human beings. So we have no previous experience. And it's not exactly the same as previous coronaviruses. It's unique. It has some unique qualities on what it infects, where it infects, how easily transmissible it is, which makes it unique and novel. So getting those data will take time. And then we'll be able to say ultimately with certainty if there is any association between disease-modifying therapies and the virus. For now, when we issue guidance, and there's guidance everywhere, actually probably too much guidance, and it makes everything very confusing. Everyone with the best of intentions has created guidance on what people should do regarding their disease-modifying therapy. The similarity between all of them is that these decisions need to be very individualized, because not only are we considering what we do or don't know about the disease-modifying therapy and the virus, we have to consider the factors that we do know, meaning things like someone's age, their comorbid or other medical conditions, if they were a smoker, if they're obese. There's a list of factors that may influence a choice of a disease-modifying therapy in this era of the COVID pandemic. But knowing specifically about each disease-modifying therapy is just going to take time to gather the information. And that's being done through multiple registries and databases across the world where we hope to learn information that really will help us make these clinical decisions.
You know, the governors of some states have announced that they're making plans to reopen for business in the days and weeks ahead. What does that mean for people who are living with MS?
Well, the good news is that MS itself is not a risk factor for the development of this infection. Okay, that's very important to know. Now, there's lots of factors that I just mentioned that do influence getting this infection and the course of the infection, but that has nothing to do with MS. One thing that may have to do with the MS is if someone has significant mobility compromise. For instance, people who maybe aren't able to get out of bed, or people who are unable to transfer out of a chair without the assistance of another person. Why that's a problem is that they may have more compromised lung function because of their reduced mobility, and that could create a risk factor. That's obviously not true of everyone with MS, and fortunately it's not true for the vast majority of people, but for that small minority of people, that's a factor that may be associated with MS. But as we emerge and open up economies and businesses, there are risks for everyone that we need to be aware of. As we open things up, that does not mean that the virus has gone away. It just hasn't. We all stayed at home so that we could flatten the curve, meaning we could reduce the number of people getting infected in a period of time so that the healthcare system would be able to provide optimal service for those who need it. If we overwhelm the healthcare system, then people who need care can't get it. And we didn't want that to happen. And we saw what happened in New York when they were overwhelmed, and it became really difficult and challenging to make sure that they were able to provide adequate care. They did, but it was really quite the struggle for them. So as we emerge, it's important for people to be very mindful of continuing to keep safe distance. That social distancing of 6 feet or more is important. Not gathering in large groups. I would still say that over 10 people is an important restriction. Wearing a facial covering, meaning a homemade cloth mask when you're out and about, not to protect you, but to protect others from you if you happen to have this virus and you're asymptomatic. Washing your hands, making sure that we are mindful of the transmissibility of this virus and doing our level best to lower that transmission so fewer people actually get this virus.
Well, Kathy Costello, thank you for all that you continue to do to improve the lives of people living with MS, and especially to ensure that people living with MS have access to quality health care. And thanks for talking with me today.
Thanks very much, John. It was really a pleasure. Appreciate it.
If you're a regular listener, then you know how frequently we talk about all the research that's been published on the benefits of exercise and activity for people living with MS. And the benefits extend beyond just physical benefits. Exercise has been shown to mitigate depression and even improve fatigue. But getting started on a daily exercise program can be challenging, and it may be even more challenging if you can't get to the gym. But it doesn't have to be. In a moment, you'll meet my guest, Mandy Rohrig, and Mandy has some great advice on exercising to stay healthy, right from the comfort of your own home. Mandy Rohrig is a physical therapist and senior programs consultant for Can Do MS. She graduated with high distinction from Nebraska Wesleyan University with a Bachelor's of Science in Exercise in 2003 and received her doctorate of physical therapy in 2006 from the University of Nebraska Medical Center. Mandy has been an active member of the American Physical Therapy Association since 2003 and a member of the Neurological Physical Therapy section of the association since 2007. Mandy specializes in the rehabilitation of individuals with neurological diseases with special emphasis in treatment of individuals with multiple sclerosis and Parkinson's disease. In addition to chronic neurological conditions, she's also received specialized training in the evaluation and treatment of individuals with balance and vestibular disorders. And Mandy serves on an advisory board for the National MS Society's Professional Resource Center. Welcome to the podcast, Mandy.
Thanks, John. Glad to be here.
On previous podcast episodes, we've talked a lot about all the reasons that people living with MS should be incorporating exercise, or at the very least, activity, into their daily routine. But as people adjust to spending all of their time at home, there can be a tendency to become less active. Why is it important for people who are relatively inactive right now to incorporate regular exercise into their day-to-day lifestyle?
John, it's especially important now. During such an uncertain time with COVID and the pandemic and people feeling like they're more confined to their homes, it's especially important to reap the benefits that exercise can offer, especially for people living with MS. So some of the benefits of exercise include both symptom management as well as potentially influencing disease progression. So exercise and physical activity can help people improve their walking and optimize their balance and improve their strength or their flexibility if someone has symptoms of spasticity or muscle tightness. But it can also help a lot with mood and cognition. And I think particularly when our moods are difficult during this difficult time, exercise can be a nice outlet for that. And as far as disease progression, there are studies that suggest that vascular comorbid health conditions, so those comorbid health conditions, so conditions that exist in addition to MS, such as high blood pressure or diabetes or peripheral vascular disease, those types of conditions can potentially hasten disease progression. And one of the ways, in addition to diet and medications, that we can influence those comorbid health conditions is through exercise. So exercise can not only help with symptoms of MS, but it can also help with potentially disease progression and overall health.
What kinds of exercises can people easily do while they're at home?
Yeah, there are lots of great exercises that can be done at home. Simply just walking around your home is a good one. Figuring out how far from one end of the house to the other end of the house can be a good way to keep track of your steps, or to go up and down the stairs, or to do squats in and out of a chair. There are many ways that movement and exercise can be incorporated at home. Some other ways that you could do it is using different videos that are accessible online. Right now, there are a multitude of them focused on exercise, but those that are focused more specifically on MS and exercise can be found on resources such as the National MS Society YouTube channel. The MS Trust out of the United Kingdom also has some great exercise videos. Both sets of videos do have exercise options for people of varying ability levels. So if you're somebody who walks without assistance, with assistance, or uses a wheelchair for primary mobility, there are those options available. But I would also encourage you, if you feel like you're kind of stuck and uncertain what set of exercises or what types of exercises might be helpful for you, reach out to a physical therapist who specializes in MS, and they can help kind of guide you and prioritize those exercises that might be most helpful for your situation. And even in this time where you can't go see a physical therapist in person, you can certainly still give them a telephone call the old-fashioned way, or you could even potentially schedule a video conference type of a visit. And if you want to find those PTs who understand MS, you can reach out to the National MS Society's MS Navigator service, and they can provide you a list of physical therapists who specialize in MS.
Well, that is really, really helpful. I know that sometimes the toughest part of exercising is just getting started. What's the best way for someone to motivate themselves to get up and get active?
Oh boy, it's tough. Finding the motivation to start exercising is often more difficult than just the exercise itself, I think. And it's difficult to exercise without MS, but it's especially difficult to exercise with MS given the fluctuation of symptoms that many people often experience. And then add on top of all of that, there's COVID, and there's this lack of structure and inability to access maybe some of the normal places that we all use for exercise, like gyms or outdoor spaces. So overall, we just might feel very much out of our typical routine. So some strategies that we could use to help us get motivated during these more unpredictable times is to create more structure. And sometimes that extra structure can encourage motivation. So, for example, delegating times or areas that you would exercise. So maybe rather than going to the gym, your new exercise space you pull out from underneath your bed and you do in your bedroom. Delegating a time, so blocking off yourself your very own individual exercise appointment. If you're someone who likes to exercise with others, maybe it's sending that calendar appointment not only to yourself, but also to a good friend so that you can exercise with a good friend using FaceTime or a video conference type of a platform. You can have step count competitions. You can try to beat your friend or your family member in the number of steps that you can get per day to try to increase your overall physical activity. And one of my favorite strategies to recommend for people, if you want to get up first thing in the morning and exercise, sleep in your exercise clothes. You're one step further along, and it's a little harder to persuade yourself to stay in bed a little longer if you're already in your gear and ready to go. But most importantly, beyond just exercise in a structured, strategic way, physical activity is a great option for people. And physical activity is all the other movement that we're doing throughout the day. So it's doing the laundry, doing the household chores, going up and down those stairs, folding those clothes, doing the gardening, vacuuming, things like that, that all counts. That all counts for physical activity and exercise. So whatever you can do to keep moving, keep moving.
Well, Mandy Rohrig, thank you for all that you do every day to get people moving and improve the well-being of people living with MS. And thanks for talking with me today.
My pleasure, John. You have a wonderful day.
I've heard it said that experience is the best teacher. But the tricky thing about listening to someone's experience with multiple sclerosis is that we all know how MS can affect different people differently. So in a moment, you're going to meet Nancy Guerrera. Nancy is a registered nurse who's been living with MS for 13 years. And last month, Nancy was diagnosed with COVID-19. Now, Nancy's experience with COVID-19 might not match up with someone else's experience. But Nancy's experience is real. It actually happened and is happening. And so we have to give it a lot more weight, a lot more credibility than whatever frightening scenario we might dream up in our imaginations. In a moment, we'll meet my guest, Nancy Guerrera. My guest is Nancy Guerrera, and Nancy was diagnosed with MS in 2007, and she was diagnosed with COVID-19 on March 2nd. Welcome to the podcast, Nancy.
Thank you. Thank you for having me.
Well, before we get into anything else, can you tell me how you're doing today?
Well, today I'm doing very well. I'd actually been up and on my Peloton, did my workout and showered, and I'm cleaning closets. So I'm doing very well. Thank you.
Well, I can't tell you how glad I am to hear that. So that's really great news.
Yes, thank you. Yes.
You know, before we get into what you've experienced with COVID-19, maybe you can tell me a little bit about your MS journey. I know you were diagnosed with MS in 2007. What led up to that diagnosis?
Well, I'll try to make it much shorter because it's such a long thing to explain. But yes, in 2007, I'm a registered nurse, so I kind of have an idea of certain symptoms, and I did jump to conclusions. It was early in the morning. I woke up and my leg was it felt very warm and not totally numb. I could feel it, but it was almost like it was asleep, and I was waiting for it to wake up, and I walked around, but it was very early in the morning. I was tired.
So I went back to bed, and I really figured by the time I woke up, it would be better. And it stayed very foggy, very odd feeling. And throughout the course of about 3 months, different things would happen. I would get very strong pins and needles going down and a shoulder all the way to my fingers. That lasted for literally 3 months. And I had already called my doctor and got into MRIs and things. So they had diagnosed me very early. But because I knew, I basically woke up and I said, there really isn't a whole lot of reasons why you have this nerve block feeling and it doesn't go away. I don't have any disc problems at the time. So I really felt that I figured what it was. And it did continue. At one point I couldn't write. I was at work and I was trying to take report on patients and I couldn't get the connection. I understood what the other nurse was telling me, but I wasn't able to actually write it. It was like a 6-year-old trying to write. And that lasted for a little while. And I had a very buzzing feeling behind my neck for a long time when I would dip my head down. I got kind of a feeling in my limbs like freezer burn. I wasn't sure if they were hot or if they were cold. I kept wrapping them up in blankets. But I never lost any use of my legs or arms or my speech was fine and I didn't have any problem with my eyes. So, it didn't get that bad, but the whole episode lasted approximately 3 months. And I was put on medication also right away. They put me on the Salumedrol, the intravenous one for a week, which I did at home. And then I've been on 4 different MS medications since 2007 to now.
And what are you on today?
Today I'm on Ocrevus.
And how long have you been on Ocrevus?
Approximately 3 years.
Oh, okay. So let's fast forward a little bit now. On March 2nd, you were diagnosed with COVID-19. What sort of symptoms did you experience and what did you do?
Well, I wasn't diagnosed until the 14th of March, but on March 2nd, I got very, very sick. I started just with some light cold type of symptoms. I was sneezing and my lungs felt very tight. They weren't congested, but if I would breathe in too far, too deep, I would cough, a dry cough. And then my fever shot up to the highest was 102.6. And I haven't had a fever that high since I was a small child. It was so high and the fever lasted about 11 to maybe 14 days actually. It just would not break. I mean, the Tylenol would help, but I had gone to my doctors. I went to the emergency room. I went to a walk-in center telling them my lungs hurt. I've got this fever for so long. Something is very wrong. It's not, they swabbed me for the flu. It was negative, but nobody tested me for COVID until I think they tested me on the 10th at the hospital because my mother ended up getting it from me and she got extremely sick and she was admitted to the hospital and she was positive COVID. So then they knew. So they tested me and my husband and my daughter and her husband and my son and we were all positive.
Oh my goodness. Any idea of where that originated from? Had any of you specifically traveled or?
No, but my son-in-law has a business and part of his business, he was in someone's home that said, he said, I am sick, and I've been traveling, but this was in February. So my son-in-law said, that's okay. I'm going to come to the house, do what I have to do. And he got sick in February. And then I guess my daughter got sick, but she's 30 and very healthy. She had a fever for a couple days and some body aches. So she really didn't think much of it. And we did all get together at one of my children's house, another daughter, for a family gathering on March 1st. And I actually got sick right away. And I don't know if that's because I have MS, but I showed symptoms within 24 hours. That's when I started with the sneezing and the cold and the lungs. And then it sort of just rolled into that high fever.
You were in a unique position to sort of compare how you were and your body was responding to COVID-19 versus other people in your own family, as you are the one with multiple sclerosis. Did you notice any difference?
Actually, well, we had my husband and I had it the exact same symptoms, the exact same course. He just started with the symptoms around 5-6 days after me, but he had the same exact course, and we lost all smell and taste for quite some time. We couldn't taste our food or smell anything, no matter how pungent that, odor was. We couldn't pick up the scent. So we were both pretty much identical. And then, my daughter had just this low-grade fever, body aches. My son, pretty much the same thing. He's 24 years old, and his lasted a long time, but he didn't get very sick. So I wasn't any different than my husband, and he does not have MS, and he's very, very healthy. No other health issues at all.
And it doesn't sound like you required hospitalization during the course of COVID.
No, I went to the hospital because after my mother was diagnosed, my mother, unfortunately, she did not survive. She passed away on March 22nd, and she got very sick and ended up on a ventilator. And when she was very sick, the doctors were connecting. Then they listened, then now they were very concerned with the family. So they were keeping a good eye on me throughout with phone calls. But one night they felt as though I didn't sound very good. So they had me come in. That's when they confirmed the test, and they felt as though my lungs sounded very clear though. And they said, we wanted you to go home and recover in your own home, unless of course your lungs start, you get short of breath and you have a problem breathing. Other than that, they wanted me home. Well, and I never went back.
Well, I'm so sorry to hear that your mother has become one of the tens of thousands of victims of this terrible virus.
Thank you. Thank you very much. Yes, it's very difficult because, of course, she was very healthy. She was 81 years old, very, very active. We didn't expect it. We haven't been able to have any services. We weren't able to be with her at all. She was alone. For her 10 days of being in the hospital, she was alone. None of us could visit her, and it was heartbreaking, and it still remains heartbreaking, and we'll have to deal with it when this is all over and we can actually see each other, because we can't be together as a family.
Wow. I am, as I said, I'm just so sorry.
Thank you.
I'm curious. As you pointed out, your symptoms of COVID-19 matched your husband's. Have you noticed whether any of your MS symptoms were exacerbated or gotten worse?
Not at all. None of my symptoms were, I find that it's a change of seasons. Sometimes I can get sort of the sensation, just I'll get like burning, tingling feelings with the change of weather. With the change of seasons, I just always have had that. So I'm having that a little bit just because of where we are. But no, I have had no, increase in any of my, no exacerbation at all. Not at all. And I healed actually. I got much, I felt better much quicker than my husband did. He's still kind of lingering on, and I've been up and up, walking. And like I said, I'm on my Peloton, cleaning my house. So I recovered fairly quickly.
As you probably know, especially as a registered nurse, Ocrevus is a B-cell depleting therapy. So it actually destroys a specific type of cell in our immune system. And I know some people on Ocrevus worry that they may be more susceptible to COVID-19, or they might get a more serious case if they do contract COVID-19. Now, of course, here you are, a living contradiction to some of those worries. What went through your mind when you first got that diagnosis, though?
Oh, I'll be honest. I was scared to death because, of course, I know about the B cells, and it's usually, when my doctor changed me over to Ocrevus, that was the main concern, of course. And I thought to myself, well, I've built up immunities to the most things already that I'd be afraid of. And you don't lose what you've already developed. So I thought I'd be pretty safe. So I really never thought of a pandemic. So when I got it, I thought, why did I take this medicine? Personally, I will not continue it. I was lucky. I did very well healing from the virus, but now I am a registered nurse, and I'm not able to work right now. I'm on leave because I'm a high risk for reinfection. Do I have antibodies? Maybe. We don't know. And I probably won't know for a while because, as you know, the antibody testing they're not using that. it's not really easily accessible like the COVID-19 tests themselves. So I don't know if I've developed any. I hope to find out. But in the meantime, I'm not, I can't go back. And I work in a general hospital, and I'd love to go and help. And I'm at a position now where I can't. And even if a vaccine came out next week, it doesn't do me any good because, as you know, the vaccines don't work for us. So I'm happy that I've done well, but I probably will not continue with this medication any further. I probably will go back to the medication I was using before.
Do you remember what that was?
I'm actually going to try to go back. The first medication I used was Rebif. Then I did Avonex. Then I went to Tecfidera, and now Ocrevus. So I would like to go back to the Avonex. I felt good on it. There was no problems. I just changed medications because my doctor suggested it. I wasn't getting any worse. And I won't have the B-cell problem with that one. So I think that's the route I'm going to take. So that way, when the vaccine is available, that I would be able to receive that.
Well, I'm sure, and because you are a registered nurse, I'm sure you're going to talk all that over with your neurologist and make sure you're both on the same page.
Right. It's just being a nurse, and I need to get out there, and I need to be exposed to people and help them. And this particular medication, without being able to develop, antibodies, it really limits me. And I'm, like I said, being stuck in the house and not having the antibodies, I'm here for a while. So for me, it's not the optimal choice. I know for some other patients where Ocrevus is really making the difference with them, I probably would look at it differently.
Well, I can't thank you enough for reaching out to me and letting me know that here you are, someone who has been on Ocrevus for 3 years, diagnosed with MS for the last 13, and having gone through COVID-19, you're up on your Peloton. That's the best news
yes,
I could possibly get.
Well, the other piece too is my husband was still positive as of last Tuesday, and I have not been reinfected. So that's kind of an encouraging thing that I have been living with him, and he wasn't wearing a mask because the two of us had it, and we're healing the same. So we have not been all that cautious, and I am not reinfected. I'm negative. So, because I've been retested and I'm negative. So that is a little bit of a reassurance to me that I didn't get reinfected as of now.
Well, that is
so maybe I have some of those antibodies.
You just may. That is really great news. Again, I'm thrilled to get good news from you, and I'm really happy that you reached out so that we can share it with others who I know have the same concerns you must have had back in March. And I want to thank you so much for talking with me today.
Oh, well, thank you for having me.
That's going to wrap up this episode of Real Talk MS. Real Talk MS is powered by the National MS Society. And as we make our way through the days and weeks ahead, I hope you'll share this podcast with others who might also gain some benefit from listening. You can share this episode of Real Talk MS by letting people know that all they have to do is point their web browser to realtalkms.com/139. That's realtalkms.com/139. And you'll find that link in today's show notes so you can easily copy and paste it right into your email or text. And I hope you'll take just a minute to visit realtalkms.com/walkms and make a donation toward this year's virtual Walk MS. Now and for the foreseeable future, we won't be seeing the Walk MS and Bike MS events happening in our communities as they always have. But as we continue making our way through these uncertain and challenging times, people living with MS need more support than ever. And that support comes from the National MS Society's determination to be there as people affected by MS need them the most. So today, I hope you'll step up and, as you're able, play an active role in furthering the Society's work by making even a small contribution. This year, I'm participating in the virtual Walk MS to honor the memory of my wife, Jean, who courageously battled progressive MS for 23 years. And I'm inviting you to help. Just visit realtalkms.com/walkms to make your donation, and you'll find that link in today's show notes. I'm John Strum. Thanks for listening. Stay safe and make healthy choices.